Yes, hello everybody, and welcome to our first broadcast about our season, country of the season, Nigeria. I have a guest today. It's Sunday. Sunday is a project manager from Nigeria with whom I carried out a project in 2019 in June. We went to Nigeria with a group of medtech companies. There were 8 companies from the medical devices sector. And at that time, Nigeria was a quite prospering country. The biggest concern when we got there was to get the visa application processed. Now things have changed a little bit, obviously, due to the COVID-19 pandemic. And we would like to interview you, Sunday, on the situation in Nigeria. My name is Matthias Brandt. I'm the responsible project manager at the time for this project. But also since 2017 for several projects from the market entry of the German Federal Ministry of Economic Affairs and Energy. Yes, Sunday, maybe a little bit about you. You were a fantastic project manager. What is your job regularly in Nigeria?
Yes, thank you, Matthias. Thanks for having me. It's a pleasure meeting you again. My name is Sunday Ngbejume. I am, like you rightly said, a project manager in Nigeria. I'm a management consultant by discipline, and I've been in this field for over 16 years, supporting different organizations across the strata of the Nigerian economy. And one of the major areas I deal in is the health sector. And it was also fun and very enlightening to receive you and the German business team, last year. So it's an experience that we really look forward to having again in Nigeria.
Definitely. I would really appreciate to travel again to Nigeria. At the time we went to Abuja, to Lagos. I was overwhelmed by the impressions that I got there, and I would definitely appreciate to come back sooner or later as the virus allows, as the situation allows. And
Exactly.
This would also be my first question, Sunday, to you. You said you're a health expert, but from a personal perspective, how has COVID affected Nigeria? Because experts were saying it's like a tsunami in Africa. It could hit Africa really like a wave that will destroy the whole medical system. What is the situation now in August, maybe 5 months after the breakout of COVID-19 all over the world?
All right, thank you. The pandemic actually came, suddenly. It was not planned for generally, like the case, as it is in other parts of the world. Of course, people had fears about Africa being the worst hit globally, but 5 months down the line, it turned out not to be the case. It was merely an overestimation. And from the numbers coming out of Africa, it's not really as bad as what was envisaged, across the globe. Like in Nigeria, for instance, as at yesterday, that's 24th, Monday, 24th of August, we had about 52,000 cases in total that is recorded. And of that 52,000 cases, we had just a little over 1,000 deaths, which represents 1.9% of the total cases. And we had almost 39,000 recoveries, of the 52,000, which makes up about 75% of the total cases. So 75% of the total COVID numbers in Nigeria actually recovered, And so the net active cases we had in Nigeria is just a little over 12,000, which is about 23.5%. So you will agree with me that for a country of a population of 206 million, having a total COVID case of 52,000 and almost 39,000 have recovered, you can be sure that it is a small drop in a very big ocean.
Yeah.
So crisis-wise, we don't have, that tsunami that was expected. All right. So it turned out not to be the case. However, one will not deny the fact that when you talk about the impact on the economy and businesses generally, particularly the healthcare sector, definitely there were some hits, along the way. So maybe in the course of this interview, I'll probably delve into details
Definitely.
as we go
Yeah.
along.
We will go a little bit more into detail about the economy impact, the impact
Yes,
on
and the healthcare
the,
sector
the,
impact as well. Yeah.
exactly, and the healthcare market. So generally speaking, the healthcare system can still cope with the cases currently, or are
Um,
there signs that hospitals, clinics are overwhelmed with patients when we think of intensive care units? Is there enough capacity at the moment?
Yeah, thank you. Even prior to COVID, the healthcare system at the moment is, as we have it in Nigeria, is somewhat grossly underdeveloped. You understand? So we have quite a bit of challenges in terms of capacity,
Sure.
locally. So when COVID came, it was obvious that the healthcare system was not in a better position to manage COVID cases, particularly when we have absence of medical equipment and technologies like that can support COVID patients. Okay, so eventually governments have to rely more on supports from donor countries in terms of these respiratory machines and the rest of the other devices that patients will really need. So what Nigeria did for the first 2, 3 months of the pandemic was to start floating isolation centers here and there. Basically, the government actually took the lead. It was basically the government that actually managed and championed the management of COVID-19 cases. So the private sector component of the healthcare system were not part of the whole system that was managing the pandemic at that time.
Okay.
However, along the line, the public sector, of course, became overwhelmed, and there was need for intervention from the private end. So what happened in Nigeria was that the corporate community of businesses like the banks, manufacturers, telecom companies, oil and gas organizations started putting money together to buy these equipment that will help the government manage COVID cases. And at some point, government also had to license some major healthcare organizations in the private sector to also come in to supplement or complement what government is doing, at its own end. So that is how, we've been managing it, in Nigeria for now.
Okay, so the private sector got active in order to support the public sector in covering the cases, tackling, when people were overwhelming the public hospitals. Okay.
Yeah, the public hospitals, the public system, government was overwhelmed. They thought they could do it because they were not sure if the capacity to manage it was inherent in the private sector. But as time went on, they became overwhelmed. So the private sector had to come in with funding, investment in terms of the equipment, bringing them in from abroad. And then, of course, also putting down some laboratories that are privately owned and hospitals as isolation centers to support the existing infrastructure that government had to put out there to manage the cases as they were coming in.
Yeah, that's interesting because I just have in mind the two hospitals that we visited, the private hospitals to me looked, I wouldn't say state of the art compared to European standards, but they were on a level where you could say, okay, people can expect to get a good treatment there. But while the public sector hospitals, of course, they offer a different standard, and yeah, I can imagine that it leads to trouble if people need intensive care, and the private sector was quite separated also from the public sector. So people who would regularly go to the public hospitals would probably not usually have access to the private hospitals because of the prices that they charge there. Yeah.
Exactly.
But generally speaking, how is the economy affected? Because the lockdown here in Germany, I mean, it has been bad enough, but still we could work from home, most of us. There was not a complete breakdown of the economy. If we speak of a lockdown, the lockdown here, I would say it was quite mild. How was it in Nigeria at the, I would say, peak of fear, I would just call it, in March and April? And how is the economy doing right now?
Okay, fantastic. You know, when the pandemic kicked in fully, I think around the end of February, going into March, that was when it became dawn on us here in Nigeria that, hey, this is actually very real.
Yeah.
So government had to impose a certain restrictions, particularly in Lagos and Abuja and the Ogun State. Those three states were on complete lockdown for like initially 2 weeks. Then later it was extended to 4 weeks. And that pretty much impacts negatively on businesses, you know, across this target state. Because why they pick Lagos and Abuja is because they represent the epicenter of the economy of Nigeria.
Yeah.
You know, Lagos, for instance, has about 22 million people and is the fifth largest economy in Africa, Lagos.
Just the city.
No? Lagos is the fifth largest economy in Africa. In fact, the economy of Lagos is bigger than the economy of Kenya and Ghana.
It's incredible.
So that tells you how important Lagos is. When you talk about business in West Africa, it is Lagos. You understand what I'm saying? So they had to lock Lagos down, and Abuja being the administrative center for political power, they also had to lock Abuja down. So it was really, really difficult for businesses all that period. Then later, government had to start relaxing, you know, the restriction just to allow business to start picking gradually and to save jobs, you know, and other means of livelihood as well. Just interestingly, Matthias, just yesterday, the National Bureau of Statistics in Nigeria published the economic performance result as at the end of the second quarter of the year, which pretty much now tell us how the COVID case or COVID pandemic impacted on the economy. And the result indicated that the economy shrunk by 6%. So, and I mean, that was expected anyway, that there was a reduction in the GDP. The GDP was badly affected, 6%. And that was even worse than what we experienced 2015, 2016, when we had a recession.
Okay.
And there are fears that going into the third, fourth quarter, the country may likely eventually enter a recession. So it's actually an impactful thing, but we are looking at how the country can get out of it.
Speaking of recession, refers to economic terms, economic numbers. In fact, in real life, how does, if it's a recession or not, but how does it affect everyday's, the people, the everyday's life? Are the unemployment rates rising, or is it more like a hidden rise in unemployment? Are there statistics about that, or is it more, in the gray sector, I would say?
Oh, fantastic question. Unemployment is rising, actually. On a national scale, the unemployment rate was around 23% or so. That was as at last year, 2019. But as we speak now, it's actually approaching the 30s, about 30% or thereabout, the unemployment rate. And I can tell you, Matthias, that another indicator that is also affecting the economy is the inflation rate. All right, the rising cost of things and items and commodities in the country. So
Sure.
Yeah, so it currently is about 12.82%, the latest numbers we got, which is close to 13%, double digit. So it tells you that it's really not that easy. And then the currency as well is getting devaluated, sort of. The exchange rate to the dollar is not so good at the moment. All these things are part of the economic hit that the country had to take as a result of the pandemic. Even though we know that these issues were underlying cases before now, but the pandemic only ended up exaggerating them, just blowing them, out of proportion, as it were. But we are hoping that as the cases begin to wind down, things will begin to shape up, in the near future.
Okay. Yeah, maybe we can speak a little bit also about the impact of the decline of the oil price, because this might affect also spending, government spending. How does this affect the economy in Nigeria? Because many people might think of Saudi Arabia, Iran, Russia, Venezuela when thinking about, okay, how might countries be affected by the decline of the oil price? But Nigeria is a big exporter, and the Nigerian state is heavily depending on the oil price, right?
Exactly. So in fact, Matthias, you just touched a very important point there. Nigeria's total revenue inflow, 85% of it actually comes from crude oil exports. And the last time the budget for 2020 was submitted and passed, that was December 2019. Nigeria had a benchmark. Yeah, Nigeria had a benchmark of $57 per barrel. That was the benchmark with which the budget was designed. But along the line, around April, crude oil prices actually fell sharply. That was the time it went as low as $20 a barrel.
Yeah.
So it tells you, in fact, government realized much later that that budget was not going to work. So your cost of production is $57 to a barrel, and then the selling price in the global market is going for $20 or less. So it was not a sustainable spending plan. So at some point, government had to revise the budget twice, to meet up with, just to reflect prevailing market conditions. And Matthias, let me tell you, the impact on that is that the projected revenue stream government was expecting to have had been knocked down very low. So what Nigeria began to do was to shift base to heavy borrowing. So now the debt stock is rising, and it's rising in a worrisome manner, because government had no other means of bridging the gap that the drop in oil prices has created. So we had to go, borrowing for now. And from the comments and feedback from the World Bank and IMF, the borrowing plan for Nigeria, they describe it as unsustainable. And that's the impact we're currently having, particularly in terms of the devaluation of the Naira, because now the foreign reserve is being depleted to bridge the shortfall in spending. So the currency is being devaluated, and then the cost of doing business, somehow has gone up. So the impact is actually very real as far as the oil and gas is concerned.
So to sum it up, you have a triple crisis. You have, in fact, the virus, which is actually not hitting Nigeria as far as the cases are concerned, but you have the currency crisis emerging from it. And also, of course, the oil price crisis leading to spendings that are definitely lower than expected. And also the unemployment that is rising, and the general economic crisis due to the inflation rate that is also rising. So Nigeria is hit severely, maybe not as we expected by the tsunami of cases, but the economy is hit pretty badly. Coming to the healthcare system, we were speaking about, yes, it can cope with the support of donors from abroad, but when we were in Nigeria, we were talking about the next 40 years mainly. We were there with medtech manufacturers that wanted to sell their equipment to Nigeria, and we were speaking about the 4 years as Nigeria's healthcare years, We were really planning that things had to change, and that the government had also a plan how things should change. They were aware that in order to be prepared for the future, Nigeria's healthcare system has to change. Also with regard to medical tourism, people going abroad to get their treatment there because they cannot get proper treatment within Nigeria. So the urgency was there. Now there is a completely different situation. So how would you say, have the government plans changed? Have generally the priorities of the healthcare market changed?
Yeah, the healthcare markets really have, as far as the Nigerian economy is concerned, has not really been given the right attention that it deserves, particularly when the healthcare actually receives just a little, around 4% of total government spending, which goes contrary to the Abuja declaration that was made a few years back, that government will be providing 15-20% of total government expenditure, channeling it towards developing the healthcare sector. So as we speak, we have a deficiency of about 16% from that target. So from 20%, we are currently running at 4%. So we have a shortfall of about 16%. So it tells you the kind of challenge that is the underlying challenge that the healthcare sector is currently having to grapple with. You understand what I mean? So when the pandemic came in, it only just came to worsen the underlying issues that the healthcare system actually had. But on the flip side of it, there was global restrictions in terms of movement. So the elite and government officials could not go out abroad to source for care as usual. So everybody's trapped within the system. So they had no choice but to start looking at the realities before them. That this is a sector that ordinarily supposed to be a lifeline to guide us through a pandemic of this nature. But because over the years it has been neglected, then government, was trapped, sort of. You understand what I mean? So I think the reality now is that they will begin to take the matters of the nation's healthcare system very seriously, particularly in light of the fact that some very senior decision makers in government have also lost their lives as a result of this pandemic. So should the system have been developed and carefully positioned over the years with the right investment and structure, I'm very sure some of these lives would have been saved. But the truth is that now it is hitting both the high, the mid, and the low strata of the economy. So everybody now needs to look inwards and see how the sector can be moved forward.
So do you think there might be other priorities compared to what we considered to be relevant 1 year ago? Do you see a shift there?
Okay, when you say priority, how do you mean, please?
Priority in the sense of what does the government focus on for the upcoming, let's say, 3 years? What would they, are they focusing on testing capacities? What is their focus on spending? I mean, they have not as much money as they expected, but where does the money go that they still spend on the healthcare market? At the time, we were a lot speaking about diagnostics. We were thinking about cancer centers in order to prevent people from getting sick, to prevent surgeries, and rather preventing. This is really what we were focusing on. How is the situation right now?
Okay, fantastic question. Currently, what government have been doing now is that they're now focusing more on ensuring that there is more access to care, particularly at the primary healthcare center level, where you have majority of the people fully concentrated. So some of the plan they had before COVID came was that they wanted to build about 10,000 primary healthcare centers spread across the entire country. And of course, that tells you that there'll be a lot of construction of healthcare facilities involved. There'll be installation of equipment and the rest of them. And due to the rising cases of non-communicable diseases like cancer, diabetes, and the rest of them, huge investments are also being made in targeted federal health institutions like the teaching hospitals, like the one in Lagos and other parts of the country, where millions of dollars are being earmarked for procurement of equipment and the building of these centers to address the rising cases of non-communicable diseases, which is fast growing in leaps and bounds as a result of the Western lifestyle that Nigerians are beginning to embrace very seriously over the last couple of decades. So it's actually triggering a need for that. And also the capital flight associated with medical tourism. So government felt that, hey, this is an indication that there's a lack of capacity and people have to go out there and spend a lot to access care as they ought to. So I think there is a consideration to look inwards. But like you rightly observed, with the economic situation on ground, it will be difficult to be able to go the long haul alone. And that is where partners, investors, collaborations with equipment manufacturers and the rest of them, becomes extremely, extremely urgent and necessary, because the capacity to develop these technologies and equipment at home is near zero. The facts are there. Yeah. So virtually all the equipment we use actually coming from abroad.
Sure. I think it was over 95% imported.
Exactly. And from the records we have, you notice that, like Germany, for instance, is the 5th biggest country that provides medical equipment to Nigeria, and we are still looking for more. So yes, we have issues, but these issues are actually opportunities for organizations, healthcare companies, equipment manufacturers out there to come in and partner with the Nigerian healthcare system to improve the lot of the Nigerian people as far as health-seeking behavior is concerned.
Yeah. So yeah, a pandemic comes especially for the medical sector with opportunities. For which subsectors would you see especially opportunities? You know a little bit, I would say, about also the German landscape of medtech manufacturers. In which fields would you say there will be a huge demand upcoming or ongoing from now on, but especially in the next 3 years?
Fantastic. Now, diagnostics is number one.
Yeah.
Diagnostics is number one. Because you see, a major reason why we have issues in terms of the quality of care and delivery of service in Nigeria is the fact that we don't, there's an issue with the quality of diagnosis. So a wrong diagnosis will definitely not produce access to good treatment or care.
Sure.
So the
best treatment will not help if the diagnosis is wrong. Huh?
In fact, you can't even run a proper treatment. You can't even do your prescriptions or whatever without a proper investigative procedure. Yeah. So diagnosis it has always been number one, and even into the next 5 years, it remains number one. That is one. Then two is the fact that, remember that the testing level in Nigeria, particularly for COVID, is arguably one of the lowest in Africa.
Okay.
All right.
I didn't know that. Well,
should the government embark on massive testing, for instance, I'm very sure that the numbers may be more than what has been currently officially documented. Now, what does that tell us? It tells us that as we are still building capacity to manage the COVID-19 cases, all right, where isolation centers are being set up. So when you set up isolation centers, for instance, you need ventilators, you need beds, you need the rest of them. So more and more of these accessories and equipment are being procured, purely to address these pandemic cases. And then in terms of the ability to analyze samples taken from COVID patients, we still have a huge gap to conduct testing in that area. So all these are challenges in our system, but they also open the healthcare system of Nigeria for opportunities and partnership from abroad to support us in building this local capacity.
Yeah. Okay. So that was number 2. Is there a number 3 also? We
Yeah.
usually go for the top 3.
For the top 3. Okay, fine, fantastic. So the other one is, let me quickly just check something here. So we've talked about diagnosis. We've talked about the COVID cases, right?
The testing,
Yeah.
yeah.
And now the third one is this issue of medical tourism.
Okay. To tackle medical tourism,
medical tourism,
as people should
orthopedics,
not go
heart
away.
cases, kidney, and the rest of them. The medical tourism will also be around with us for a while. Okay. A recent publication that I just got through, just for this year 2020, the tourism spend has actually gone up. It's actually close to $2 billion now, as against 1.3 that was being reported in the last few years.
Yeah.
It has gone to about 1.9 billion US dollars as we speak.
Going out of the country and
it's growing because the demand is also on the rise. The capacity to meet those demands is not meeting up with the increasing demand. And that is where the gap lies. And these gaps is what we believe should be able to attract the right investment to help us locally to address, the issues.
Yeah. When speaking about medical tourism, how was it done during the pandemic? So you mentioned in the beginning that even government officials had to stay in the country. How is the situation at the moment? Can people travel outside the countries with urgent need for treatment?
Not at all, because
not at all.
Not at all, because what happened is this. I'll tell you this. The federal government actually restricted movement in the airspace. So though for now, they've lifted restrictions for domestic flights in the country. But come 29th of this month of August, government actually declared that from the 29th, they will allow room for international flights.
Okay.
And trust me, there are many people, the high income earners, top government functionaries that are waiting in the wings for the international airspace to open.
To get their treatment abroad.
They are getting out from the blast of the whistle, honestly, because the capacity at home cannot support the quality of care they would have preferred to spend their money on.
But not with regard to COVID usually, but to other diseases that they need treatment for.
Of course, because in fact, it's not even about the COVID. The issue here is that if there's an underlying issue like kidney-related cases, cardiac-related cases, and COVID sets in, it can be a very mortal case. You understand what I mean?
Yeah, sure.
So, and some of these, high paying individuals tend to have these underlying cases. So they run the risk of almost losing their lives should COVID come in. You understand what I mean?
Yeah,
so as soon as the international airspace is open, I want to believe that many of them will set sail abroad for effective care.
Okay. Yeah, thank you. I think this was a big update on the healthcare sector in general. What some of our listeners might also be interested in is, of course, how does doing business, how did it change recently when COVID hit the country? Are people open for digital communication just as we do? We are now having an interview on Zoom. Are the business people in Nigeria open to things like that? Virtual conferences, virtual matchmaking even? What do you think?
Now, okay. Before I go there, Matthias, let me just quickly chip this in terms of the impact now. For some time, the growth rate in the health sector has been 0.16% or thereabout, very, very low. But with the advent of COVID and the fact that people had no choice but to look inward due to the restrictions, the economic numbers that was published yesterday, Monday, 24th of August, 2020, revealed that the healthcare sector actually grew by about 2%. That's the highest I've seen in years.
Okay.
Yeah, because over the years, it has always been negative. And just last year, just yesterday, at the end of the second quarter of 2020, the healthcare sector grew about 1.87%. That tells you that a lot of things actually happened within the healthcare sector in the course of this COVID to bring it up in terms of managing the cases and other, not just COVID cases, other underlying cases that COVID could trigger mortal issues. You understand?
Yeah.
So it tells you that with deeper focus, the healthcare market could also grow. Now, talking about the impact of what has really changed in the way we do business and how technology is playing a role, very important question. I can tell you, Matthias, that there's a new normal that we are trying to adjust our lives to now. You know, particularly
Plan B has
Nigeria.
become Plan A.
Yeah, so that's a new normal now. So even schools now are doing some of their courses online.
Far ahead of Germany, definitely.
Yeah, online. And in fact, our parents are willing to pay now, unlike before. Okay, now even businesses, banks, manufacturing outfits, corporations, most of their businesses are now done online. People work virtually now. So now, in terms of the numbers, when the economy shrunk by 6.1%, the telecommunication and ICT sector of Nigeria grew by 18%.
Wow.
It grew by 18%. And I can tell you, Matthias, that the technology space has overtaken oil and gas in terms of contribution to the GDP.
Wow. Okay.
Telecoms, the technology market in Nigeria now contributes about 10.88% to the GDP, while oil and gas is contributing just 9%. So it tells you where the economy is going. A paradigm shift now. People are now going online to do their businesses. And that is the future. Even when it comes to matchmaking, business interaction, trust me, Matthias, that is where the future of business now lies in Nigeria.
And bringing the two together, IT, cyberspace, and healthcare. I know that there are a lot of startups in Lagos in general, but especially in the e-health sector. Maybe an update on that. Are there any promising startups that you would know of offering technologies that might also help us to tackle the pandemic?
Yes, I know that there are quite a lot of them. Telemedicine is gradually on the rise. It's gradually on the rise. Electronic health insurance scheme is now on the rise. E-consultation is now going up. You understand?
Yeah.
So although for now, there may not seem to be any strong structure around them, but the reality of the times is forcing the emergence of these facts. And over the next couple of years, they are going to take a very serious position as far as healthcare access is concerned, you know, in Nigeria.
As far as I experienced the Nigerian market for the, let's say, 4 days that I was there, I had this impression, especially in Lagos, that people are very pragmatic. They really see solutions and then they apply them, try them, and they are maybe much more open towards opportunities and taking the risks, of course, than we would probably be here in Germany. So I would see for especially for the e-health sector, big potential because the market is so huge. As you speak about e-consultation, if you want to travel to a doctor, which is 10 kilometers away, it might be a day trip for people living in rural areas. So I think there is a huge potential for that in Nigeria too. Wow.
Let me tell you why it is going to work. Let me tell you why it's going to work. Now, in terms of telephone access in Nigeria, right? Nigeria has over 180 million phone lines.
Yeah.
You understand what I mean? So that cuts across the length and breadth of the nation, rural and urban. Now, internet access in Nigeria is greater than the average internet access in the whole of Africa.
Yeah, and in Germany,
So,
I would say.
yeah, so because I think the internet access in Nigeria is about over 60% going to 70%, 65%, quite huge. I think the net internet access rate for Africa is about 23% or so. So it tells you, you know, the differential is huge. So should e-medicine begins to crop up as a major issue or as a major reference point, the infrastructure to support it is gradually being strengthened on the ground. I don't know if you get the point I'm making now, including the payment systems, all right? They are already on ground. And what COVID has done is to compel people to leverage technology, whether business or healthcare. And that is the future that we see. There's no shying away from it.
So would you say COVID, seeing it as an opportunity, especially for the healthcare sector, can work as an accelerator for new technologies in Nigeria?
Spot on, exactly. Because the decision makers themselves were also badly hit. So should we have, you know, God forbid, but should another pandemic crop up tomorrow, we cannot afford a repeat of the incidents or experience that we had now. So I'm very sure that in the next couple of years, a lot of things are really going to change.
Well, but maybe in a different manner than we expected them to change 1 year ago.
Exactly. In fact, let me mention this, and this is very, very recent, and I want our audience to go check it out. 2 days ago, the Federal Minister of Health had to summon the Guild of Medical Directors and the Association of Private Medical Practitioners in Nigeria to Abuja to discuss with them how to manage emergency cases in the country, because it was obvious that the emergency management system in Nigeria was just not there. All right? So they needed ambulances and the rest of them. In fact, it's the statistics I have, and I stand to be corrected, is that in the whole country, the ratio of ambulance to population in Nigeria is about 1 to 200,000. It's about 1 to 200,000. So how do you want to manage emergency cases when you are shuttling from the patient area to the health facility or to the isolation center in the case of COVID, for instance? That was what led the minister to summon the Guild of Medical Directors and private medical practitioners to Abuja to work together to see how the private sector can work with government to bridge this huge gap when it comes to managing emergency cases in Nigeria. So those are the challenges we have, but there are also opportunities which I believe Nigerian medical or healthcare practitioners will want to latch onto. But what they need will now be having the right partnerships to support their ambition to bridge the gap locally.
Yeah. When speaking about emergency cases, I realized when we were in Lagos, especially in Lagos, Abuja was fine with regard to traffic, but in Lagos, you really cannot access any emergency within a reasonable time frame. Because just the streets are so crowded. So I recall that we were talking about drone solutions delivering, for example, the defibrillators or emergency equipment that could be delivered by drones. So I think all of these solutions that in Germany are, I would say, currently quite unimaginable, could be rolled out in Nigeria, in Lagos first, and then prove there in an environment which is challenging for, let's say, traditional solutions. And can be a test laboratory for these kind of solutions that are pretty avant-garde, I would say.
In fact, I know of some organizations that are trying to also leverage and create a business case out of that aspect when it comes to delivery of emergency services and emergency supplies. For example, like blood, the blood banks and the rest of them, just to save lives in difficult to access areas. Okay, I know of companies like Zip Life that are they've been experimenting in Ghana. I I think since last year or thereabouts. And I'm very sure that their ultimate aim will also have to be Nigeria, because this is where the big fish is really sitting. So any solution that can dimension the emergency cases in the country, the emergency supply chain, and provide the necessary bridge will definitely thrive. You know, with the right partnership with local players here, it's going to thrive, because it's an issue that we have here, a major one at that.
Perfect. I think, Sunday, this is an excellent closing statement. I think we got a overwhelmingly interesting insight into the current situation, both in general, how the economy in Nigeria is affected, but especially on the healthcare market, and also on opportunities for German companies from the medtech sector, from the e-health sector. And I'm very much looking forward to grab some of these opportunities with you. So we will work together on bringing German companies to Nigeria in order to tackle both the pandemic, but also the general situation in Nigeria with regard to limited capacities, capacity constraints. And yeah, I think, Sunday, with you, we have an excellent partner at our side to do that. And I would like to thank you very much for your time, for the interview, and for your support.
Thank you very much.